A steering committee to investigate racial discrimination in the healthcare system by medical aid schemes. This after the CMS met with several medical bodies representing doctors as well as the Health Professions Council in Pretoria today. For more on this, we now cross to our reporter Patricia Visagie, who's in Pretoria and has been following the story. Patricia, thanks for joining us. Give us a sense of what's been going on.
Well, good afternoon. Just after that press briefing that we observed, we, of course, heard many of the panelists that are here calling for this particular probe not to take longer than 4 months, saying that they hope to see preliminary findings and recommendations being tabled in perhaps just after 3 months. They want this process to really move very quickly. So let's speak to one of the panelists, and that is Dr. Donald Gumede. I think one of the big issues that we are worrying about, and that we've even heard from the floor and the panelists really touching on, is what happens to the doctors that are waiting for their payment while this probe is actually pending. What must happen to them? And that is the concern. How many doctors are we talking about who are awaiting a payment, and how do you think this matter must be tackled?
Yeah, thank you very much. There are many of them. I cannot quantify them, but there are many, and it's huge amounts, actually. So it would be very important for the Council for Medical Scheme to actually instruct these medical aids to release the funds. Like one of the panelists said, that it's illegal for them to withhold funds just to try and extort money from the healthcare professionals. So if the service was rendered, the money must be released so that life must go on with those professional healthcare professionals. 4
months, that is what I even asked earlier. Is that enough time to really, delve into, a violation, unlawful practices that have been taking place for so long? I mean, we're talking about lots of years here. Is 4 months enough?
It's never enough. We raised it during our preliminary sessions. It's just to deal with Section 59 of the Act, that 4 months. So that, because it's the one that actually is giving these forensic people to be doing these illegal activities. So we are saying they must make a declaration as to say this cannot be done in the democratic society where people have rights. And you cannot just violate people's rights because you believe you have money or you belong to a certain organization.
How has this affected the industry? If you can just maybe paint a brief picture of how deep this crisis is.
It's very deep. Healthcare professionals have killed themselves. They've gone out of business. They've left the profession. Patients have been left destitute as well because of this, because they've lost their healthcare practitioners. And as well, the medical aid have just gotten a strong hold into the health system because now they dictate from the healthcare professionals, and they dictate to the patients how the business of the day should be run, which actually is very bad because imagine the patients are actually the kings here. They're the ones who are actually paying for these services. But then they deny the right to choose their own practitioners, they deny the rights to exercise their will to where they want to go. So it has actually deeply affected lots of, I will state again, black professionals. They have been affected very badly.
All right, thank you so much. Let's speak to one of those black professional health practitioners who have been affected badly by these particular malpractices. I'm now speaking to Dr. Just introduce yourself.
Rutendo Paswana.
All right. Just give us, in a nutshell, your story. How have you been affected?
I think the reality is that the case with the medical scheme has gone on. In this particular instance, it's a med scheme. It has gone on for over a year, from January 5, 2018 until today. And the issue at hand was that even the process that was followed, in my view, and having sourced the advice, it was flawed because there's no investigation that involves getting any information from the care professional. It just became an issue where simply you get a letter that says you owe so much, and this is how we are going to claw back. All of a sudden, from that point onwards, you're not getting any payment. And I mean, how can you function over a year? I mean, our practice employs almost 15, 16 people. And somehow we had to lay off some of the people because we couldn't afford anymore.
Okay, let's get another voice here. Here's another doctor who is also impacted by this particular issue. Just give us your story.
Hi, I'm Dr. Meti. I'm a dentist. I've suffered a lot from medical aids. Precisely, they would frequently request confidential patient records. And what I have realized is that, as healthcare professionals, we are the most important stakeholder in this whole equation. But the medical aids, in terms of legitimacy and power, we are the most powerful. Without us, medical aids will never treat patients. But they have turned the equation around, that they're treating us as the least, stakeholder in the equation. So how they determine whether you are being fraudulent or not, they look at the financial performance of your business. So if your business grows, automatically it triggers them that you're fraudulent. So I really subscribe to good ethical practice. That's what I do at my practice. However, they send investigators, spy cameras, they call patients. So even if you're ethical, but you're performing well, you're growing as a business, it's a problem with them. So I want to appeal to the medical aids. Number one, the country must realize we've lost lives of healthcare practitioners under the medical aids, precisely discovering. And they are not even apologetic. They say, no, they're fraudsters. But the process that was used to investigate those people was illegal. We want to appeal to medical aids to treat us with respect. We want to appeal to our patients to help join with us, the forces, to really bring these guys down, because they are really, really not being fair to us. And they determine the level, the quality of the treatment that we should give to our patients. When you have a diagnosis, they come and say, no, we can't pay for that. Instead, do this. So effectively, they are the ones who are diagnosing the patients on our behalf. So we are saying to them, please stop abusing our practitioners. And we are saying to our practitioners, we are not fraudulent. Not all of us are fraudulent. There are good guys out there, but we are all treated to the same pain, that we are all fraudulent. So we want to say we are not fraudulent. We don't promote that kind of practice. However, medical aids as well are being fraudulent. The amount of money that they take from patients that they invest amounts to fraud as well, and no one is really investigating that. So we want to say to South Africans, do not look at fraud as something that's being committed by practitioners. But you must also be careful that medical aids as well are committing fraud. And there's a tendency in our country that, when fraud is committed by black people, there's just a hell lot of noise about it. But when it's not blacks, it's been treated, as something that is actually promoted. Now, if you find a number of black practitioners committing suicide because of this process, and there hasn't been any investigation to the medical aid schemes to say it is because of your illegal investigations that are leading to these suicides, that are leading to businesses being closed, that are leading to black professionals being unable to prosper. There isn't nothing that is being done to actually regulate from the medical aid perspective. So in short, I would like to say the medical aids must stop abusing our practitioners.
Okay, I'll have to leave it there. We have run out of time. So there you've heard the voices of the various healthcare practitioners. They're just, giving their side of the story, how they've been impacted by some of these malpractices and unconstitutional behavior from the medical aids, of course, allegedly. But the probe will now get to the bottom of things, and we'll have to wait and see how exactly everything will be panning out. We've run out of time. It's back to you in the studio.
Patricia, thanks very much indeed. That's our reporter, Patricia Visagie, on top of that contentious story. We're going to take a quick break.